Hello everyone, and welcome to the Red Pill Patriot Show official YouTube channel. My name is Dr. Matt, and on this, my very first video on here, I wanted to share with you my thoughts on a little something that's been circling the internet. Now, if you're new to the channel or new to my podcast, the Red Pill Patriot Show, you may not know anything about me or who I am. But what I want to do is take this opportunity to simply share with you this video and then share some thoughts, because it's important that we understand what's going on. And in this day and age, especially in 2020, with the election looming, there's a lot on the table for Americans. And I have some very strong and passionate feelings about America and what we should be doing as citizens. So without further ado, let's just jump right into the clip to kind of let you know what this is before we get started. This is a video, and then you're going to just see still shots. I couldn't get the video itself, so you'll hear the audio, but I got some still shot pictures there. But anyways, what this is it's a little clip off of MSNBC. And the anchor introduces a union rep, I think, with a nurses union out of California. And in particular, she's talking about a letter that one of her nurses wrote with regards to the CDC not allowing her or giving her the opportunity to be tested for the coronavirus that she thinks she has. So let's listen to the clip, and then I'll be right back afterwards.
As coronavirus spreads in the United States, the nation's testing capabilities are not keeping pace. Tonight, the largest union of registered nurses, National Nurses United, is raising alarms that members of their union are being denied testing after potentially contracting coronavirus from infected patients. Joining me now is Bonnie Castillo, a registered nurse and executive director of National Nurses United. Ms. Castillo, you have a member who wrote a letter today, and I wondered if you can give the context for that letter.
Yes, we do. We have over 80 registered nurses under quarantine, and that list is growing daily. And we had a nurse who wanted to express her experience and convey her concern with regards to the bureaucracy of the testing and the fact that she has not been able to get testing despite having cared for a positive patient.
I'm wondering if you could actually just read that letter, because I found it really powerful. Will that be all right?
Yes. So this is a statement from the quarantine nurse from a Northern California facility. As a nurse, I'm very concerned that not enough is being done to stop the spread of coronavirus. I know because I am currently sick and under quarantine after caring for a patient who tested positive. I'm waiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered it. I volunteered to be on the care team for this patient who we knew was positive. I did this because I had all the recommended protective gear and training from my employer. I did this assuming that if something happened to me, of course, I too would be cared for. Then, what was a small concern after a few days of caring for this patient became my reality. I became sick. When employee health told me that my fever and other symptoms fit the criteria for potential coronavirus, I was put on a 14-day quarantine. Since that criteria was met, the testing would be done. My doctor ordered the test through the county. The public county officer called me and verified my symptoms and agreed with testing. But the national CDC would not initiate testing. They said that they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus. What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of our country's health.
Okay, it's time for me to break this down for you, okay? This letter, and again, I feel bad for this woman being sick. I really do. I feel bad for anyone that's sick, whether it be coronavirus or anything else. If you don't have your health, it's very frustrating. But in particular, with this letter, she talks about a few things, and one of which is that this is a health crisis and not the deli counter where you go and pull a ticket and wait in line. Well, I have some news for you and for everyone else out there that's having an issue with this. This is the product of what you can expect under Medicare for all, socialized medicine, whatever you want to call it. When you have a single payer system, this is what we're going to be dealing with, is lines. Because under a Medicare for all system, or whatever you want to call it again, they ration care. Why do they ration care? Because the government controls everything. And right now, guys, right now in this instance, we are currently seeing that. It's projected that by next week, the government will have produced about 1 million tests, okay? 1 million tests for a country of over 320 some odd million people, okay? There is more demand, potentially, than there is supply, okay? Basic economics, at least here in America. When that happens, when you don't have enough, like I said before, you have to ration care. You have to wait in line. Now, it should be noted that under President Trump and Vice President Mike Pence, they are currently doing everything they can to get the capitalist companies to produce these tests. They want to expand who can produce these tests so that you and me and anyone else that thinks they may have coronavirus can walk into your local Walgreens or CVS, buy the test, do the test, and whether it means mail off for the results or get the test results instantly, we can know if we have it, but we don't have that yet. Right now, the government controls the production of these tests. And that's why this is so ironic, because right now in 2020, like I said, we have an election coming up. There's an election in November. And what are the choices looking like right now? Well, if you like President Trump and you think he's done a good job for most part, you can re-elect him. And that's where I'm at. I didn't vote for him in 2016. Wasn't sure what kind of president he would be, but I'll tell you what, he surprised me on a great many things. He's done a good job. He's not been perfect. America's not perfect, but it's pretty dang good. And it's gotten better under the administration of President Trump. Okay? Now, if you don't like President Trump, which is your right, that's fine. You got a choice. Right now, it looks like it's shaping up to be either Joe Biden or, heaven forbid, Bernie Sanders. Okay? Now, shameless plug for my podcast. If you don't know much about Bernie, or you think you do know about Bernie, check out the episode that's coming out next week. It's called Bernie 2.0. It's going to talk to you all about who is actually with Bernie as far as his campaign and who he's surrounding himself with, because as my mother used to tell me, show me your friends and I'll show you your future. Well, I'm going to show you Bernie Sanders' friends in the campaign, and that should help you understand what the future will be like if he gets the nomination and wins the presidency. But back on topic. I'd like to take a moment to compare a couple scenarios here, okay? Because we've seen these health crises before, okay? The last one that I want to think about is the H1N1 virus under President Barack Obama, also known as swine flu. When that hit, President Obama waited a full 6 months before declaring it a public health emergency, and at that point in time, we had over 1,000 deaths from that. Okay, so 6 months, 1,000 deaths before it was declared a public health emergency. And at that time, President Obama released just $1 million in aid to help combat that. Okay, let's flash forward to 2020 and the coronavirus. Under the current administration, we've had a total of, I think, 10 or 11 deaths. President Trump released $2.5 million initially to combat this, and then Congress, I think, added on so much more. I can't remember the exact numbers, but it's now like $8 million to combat this, okay? There's a big difference, folks. So I'm not trying to create a panic. I'm not trying to freak people out. The average American that may contract this, you're going to be fine, okay? It's not a killer disease that's going to wipe out the population. The media is spinning it that way because they want you to be fearful. Do you need to prepare? Yes. Do you need to be ready to potentially self-quarantine if you feel sick? Because that's the best thing we can do as a people right now. Okay, since there's not enough tests, since there's no vaccine, there's no medication right now, the best thing you can do is prepare to possibly stay inside for 2 weeks at a time. I think that's kind of what the CDC is recommending. Have some food, have some water, have, toilet paper, because that apparently is being hoarded by tons of people. Have the necessities to take care of yourself for about 2 weeks, and then stay inside. Okay? Don't go out. Now, if you don't have that opportunity to do that, well, be careful. The masks are not doing their job, and we could talk about that. But anyways, case in point, I just wanted to reach out to you guys and let you know that one, this example, this video, this letter is a foreshadowing of what we can expect under socialized medicine. If you don't want to wait in line, if you don't want to have rationed care, if you don't want these kinds of things, because in America, things sound good. When you hear it, oh, that sounds great to take care of everyone, free healthcare, blah, blah, blah. It's not a reality. And if you'll do any research at all and look at other countries that have this, they're miserable. And if you want to make a comment, that's fine. I know you're probably going to say, well, what about Scandinavia? What about Sweden? What about Denmark? Well, in my podcast, I've actually done an episode about that and compared what Bernie is saying the Scandinavian countries are like and what they're really like. So you can check it out. Okay? Now, lastly, just want to sum things up. You can check out my podcast by going to redpillpatriot.net. That's my website, and you can listen to the episodes there. And I hope you guys enjoyed this video. Like it. If you like what we're saying, go ahead and hit the little bell there so you can subscribe, be updated anytime new content comes out. And you guys have a great day, and hopefully you can all stay coronavirus free. It's Dr. Matt for the Red Pill Patriot Show. Bye-bye.